Back on Morningline, final segment. If you'd like to join with a question about your heart health, give us a call. Dr. Joshua Beckman is with us from over at Vanderbilt. It's good to have him on. You know, we had someone during the break that called in and couldn't stay on that had a question just about taking an anti-anxiety medicine, and she didn't recall exactly the type, and that actually started giving her high blood pressure. The anxiety medicine helped, but the blood pressure went up, so she came off it. But the doctor said, you know, we can have you on the anxiety medicine, and then we can give you a blood pressure pill to help with your blood pressure, like a pill for a pill. She was just wondering, you know, I don't know if I want to do that, though the medicine originally did help me with my anxiety.
Yeah, that's a complicated one, and sometimes we run into that situation. I will say there are a variety of medicines for anxiety, and maybe the better choice is to try a different one first. But if that's the one that works and anxiety is a really limiting problem, then what we do is we give the patient the treatment that she needs. And then if there's a side effect that has to be managed, we manage it. But it's better not for her to feel anxious all the time and have a perfect blood pressure and be limited in what she can do and feel terrible. We certainly want to make sure she doesn't feel terrible.
Gotcha. Okay, good. Let me ask you, if you do this, can you rank the risk factors for heart disease, meaning like smoking, excessive drinking, high blood pressure, high cholesterol? What's from worst to first, if you go down the line to maybe the least? And I know you're going to tell me, well, they're all important, of course. But I mean, if you're going to get started addressing an issue, you know, and you have a lot of these risk factors, but you can't do them all at once, you're going to do one at a time, what's the first one you should attack?
By far, the easiest one to attack is stopping smoking.
Gotcha.
That one. So, stopping smoking is the thing that you can just get rid of. Now, I'm not saying it's easy. It's not easy. It's hard. But that is something that you are doing to yourself that can just be stopped. And the benefits to stopping smoking start really quickly. After that, the second, probably the worst risk factor besides that is diabetes. So we want to be working really hard to try and avoid getting diabetes. And if we get it, there are now medicines that can reduce heart-related problems with diabetes. High cholesterol is a problem, and we have incredible medicines for it. But I would put it as the next one lower down, unless the levels were off the wall. And high blood pressure is sort of around the level of cholesterol, in that when it's mildly elevated, it's a problem. When it's very elevated, it's a very serious problem. And so there are different levels of severity based on what your numbers are. But if you want to know what is the worst thing you should get rid of first, stop smoking. It'll help every one of the other problems.
Okay, and when you say diabetes, I mean, you can say, well, diet, and looking at that, does that mean I have to give up lamb chops?
I don't know. How often do you have lamb chops?
Probably too often. No, actually, that's a good question. Maybe once every month if lucky.
Then no. Once a month, you don't have to give up lamb chops.
Okay. Thank you.
I think the answer, I would say, the red meat, you want to limit it, but I don't think it's reasonable for me to say cut out everything totally from your diet. It's a moderation question. So red meat, try and have it no more than once a week, for example. And if you love lamb chops and you don't feel bad about those lovely little lambs,
I know.
not a problem.
Okay, let's go to Becky. Becky, good morning. Hi, Becky.
Hello.
Hey.
Yes, I wanted to ask you about the low-dose baby aspirin, the advantage to that, or what does he think about the low-dose aspirin?
Okay, great question. That's been around a while.
Yeah, so first of all, I do think, first of all, that the low dose of aspirin, if it's going to be used for heart health, is the one to use. That's the one we use in basically every setting now. Now, that said, as a way to reduce heart disease in people who are otherwise healthy and older, it doesn't really have a great benefit anymore. And so we reserve it for folks who are at higher risk, like what the nice caller mentioned earlier with calcium on her calcium scan, or some other risk factors. If you have diabetes and you're at a higher risk, it seems like it may have benefit, but I think we're prescribing aspirin less often now than we did in the past, maybe because our other medications and interventions are doing so well that the benefit of aspirin is smaller than it used to be.
Hey, listen, as we just wrap things up, Dr. Beckman, and you do such a great job of laying all this out. I really do appreciate you coming on. Any parting shots here with regard to maybe looking ahead to the future? I know much of what we've talked about is something that you and I have talked about in the past, and it still pertains today. But are there new things on the horizon? And I know there are new medicines that come out every year, I suppose, that work better. What can we look forward to with regard to heart health in the future that maybe is a lot different than we're talking about now?
There are a couple. This field is moving ahead incredibly quickly. There are a variety of medications that can make second heart attacks much less likely. There are also medicines that are coming down the pike that need a single injection every 6 months to lower cholesterol. And then there are some people who are even looking at ways to change the DNA in your liver so that you can lower cholesterol with a one and done shot. Now, these things are far away, and they're not going to happen next week. There's also approaches to try and reverse diabetes by changing what's going on either with medicines or in your intestines. And so I think it's an incredibly exciting period, and our ability to understand what's going on is speeding up dramatically. What we need to make sure that we do is learn how to explain those new things really clearly to people so they understand them also. And I think there's work to do in discovery, and there's a lot of work to do in explaining.
Doctor, I really appreciate it coming on because you do a really good job explaining. Now, I want you to go get something better for breakfast than just a cup of coffee. You could go get yourself an egg sandwich.
I could, but I won't.
You're going to have granola, aren't you? You're going to have granola, aren't you?
With some fruit and a little yogurt.
You know what I like about you is you practice what you preach, and that's the way it should be. I really do appreciate you. Hey, listen, thank you for coming on, and we'll talk again. It's nice doing this virtually. The signal came through great, and I love the red background.
Thanks, and it's such a pleasure to be on, and it's so fun to be here with you. I just can't thank you enough for letting us talk about Heart Month and heart health.
Anytime for Heart Month and for you as well. Thank you again, Doctor, for coming on, and we'll see you down the line, all right? Thank you, sir.
Sounds good.
Hey, listen, let's take a quick break on that note, and really do appreciate him coming on. I hope that helped a bit. You learned a few things. That's something I could talk about for hours with him. But we'll take a break. I'll come back, programming note about what's going down tomorrow right after this.